Home Secretary Priti Patel was asked if she'd apologise to health workers and their families.
I'm sorry if people feel that there have been failings. I'll be very, very clear about that. But at the same time, we are in an unprecedented global health pandemic right now. It is inevitable that the demand and the pressures on PPE and the demand for PPE are going to be exponential. They're going to be incredibly high. And of course, we are trying to address that as a government. And I think that is right. That is our priority.
Let's go live now to Nadim Barber. He's in London, and it doesn't seem like that apology has made the situation any better, does it?
Sammy, I don't think it has. There are commentators across the board, you know, from broadcasters even to government-supporting newspapers who've been very harsh in their analysis of that daily briefing on Saturday with the Home Secretary, who hadn't been seen in public for some time, actually. So lots of attention, particularly on that event. And the feeling is that her message was, I'm saying sorry that people are feeling that way. Twice she was pushed to actually apologise to the families of health workers who've died after contracting coronavirus. Now, on Saturday, the Health Secretary, Matt Hancock, on Friday, the Health Secretary, Matt Hancock, did say that he would start an inquiry into the deaths of the many NHS nurses and doctors and health workers who've died. It could be as many as 28, according to some counts. But that was to see if they had contracted the virus at work rather than failures, and whether it was the lack of protective equipment which contributed to their deaths, as many families are saying. So in that context, and also in the context of Mr. Hancock saying that health workers should use equipment sparingly, which also went down very badly with people in the NHS, if you look at social media. That was the context in which Priti Patel's non-apology, if you like, has been received. And it all does add up to a growing surge of demand from within the system and outside for really getting a grip on the problem. Now, of course, on Friday, the UK says it received a shipment of 250,000 individual items of protective equipment from Turkey. They, though, have to get distributed around the country and to the right places. So Priti Patel did say the government was doing all it can. Perhaps they are now in terms of moving the equipment around, but in terms of actually messaging, I think they're not going down very well.
And Nadim, in Russia, we've had a sharp rise in the number of cases. Is that the result of more testing and better detection, or of a real sudden surge in the virus?
No, Sammy, I think it's more the latter. I think that already the Kremlin has admitted that there is increasing pressure on hospitals, both in Moscow and in St. Petersburg, as the number of cases rises. Now, the death toll in Russia is still relatively low. It's risen in 24 hours by 129 to a total. Sorry, I'll give you that again. That was incorrect. The number of deaths have risen by 24 up to 130, but it's this rise in cases in 24 hours, almost rising by a third, to take it to 2,186 cases, confirmed COVID-19 cases in Russia. The real figure, as in other countries, could be larger, with people actually dying in the community rather than in hospital. But the Kremlin is admitting that there is an increasing problem. So far, President Putin has delegated responsibility to other people. He hasn't been giving these daily briefings, for example, but there is an admission that there's a problem. It's in sharp contrast to places like Germany, where, in fact, there have been many more cases, but a comparatively low death toll. The death toll in Germany just rising in 24 hours by 129 compared to that figure in Britain, which was almost 1,000. And the reason that people think that's so low is because of testing, which has happened in the weeks leading up to now. Testing and contact tracing. Now, the government in Britain is saying that they will get better at doing that. They have, well, their scientific advisors have admitted that they could have learnt lessons from Germany earlier on. They say they're getting better at it, but so far the testing target for Britain is 100,000 per day at the end of this month. We're less than 20,000 a day at the moment, so a lot of catching up to do.
Indeed. Let's thank Nadim Barber there from London.